Hey y'all, it's Dr. Tiffany. I hope you're doing well. So today we're going to look at some science. This was published in the Lancet, one of the premier medical journals in the world. It's a large study that shows that, among several other findings which we would expect, that long flu is actually a problem. Most people who follow me are familiar with long COVID being a problem, but long flu is also so. It looked at around 90 to 100,000 patients. And for the flu, they used some data pre-pandemic and some data current. And for COVID, they used about the pandemic data, which was about 80,000 patients. The flu cohort had about 10,000 or 11,000 patients. What they found is that in all categories, they looked at things like death, health loss, and healthcare utilization, that they were markedly elevated in both flu and COVID, both in the acute and in the long-term phase. So what this means is that over a long period of time, that flu and COVID both continued to cause elevated rates of death, health loss, and healthcare resource utilization, meaning that people who are post those two problems were sicker, more, and for longer periods of time after having these diseases, which to me casts serious light on a problem that we really have been downplaying for some time. Now, the COVID categories were all quite a bit worse. Okay, we're talking a significant percentage worse than the flu, which anybody who follows science knows that that's true. But also, long flu isn't something people really thought about existing. The symptoms weren't really delved into great depth, and there's a lot of data in this study, so I'm not going to present individual stats. That's also why I put it up here for somebody who wants to read it. This is actually quite illuminating, and it's a strong study that bears looking into. There's some limitations in that it's used VA patients for the most part, which tend to be older white males, and it had to use some historical data for the flu pre-pandemic data because, in all honesty, with social distancing and the lockdowns and all that, there really wasn't any flu for a couple of years. So, also, there's not really any data about what would happen if these two occurred together, which it's possible that people who had long flu were already predisposed to long COVID. So that's something that needs a lot more looking into. And also, there's no examination of time frame between the two. If you had flu and then you had COVID in the same month versus in the same year and 2 years apart, whether or not the rates were anything worse. So there's still some science to be illuminated here. But this is a very concerning study and a very interesting study in my opinion. I wanted to bring it to you on kind of a hard science dive on this, okay? So if you're interested, check it out. There's the information right there. It's public access. I love y'all. Stay safe.